Welcome back, our dear viewers. One of the things that give us charisma and also give us like a beautiful look and enhance our confidence is our hair. The hairstyle that we wear, it also represents our responsibility and also like our character in front of other people. However, there are hair loss issues, differs between men and women. In its pattern, typical causes and severity, men typically experience a reducing hairline and thinning at the crown, progressing to baldness due to genetic and hormonal factor like DHT. Women generally experience diffuse thinning across the scalp, often triggered by hormonal changes like pregnancy and menopause, stress and nutritional deficiencies, but rarely reach complete baldness. Our guest is a bachelor degree, Royal Challenge of Surgeon in Ireland, PhD, Kuwaiti Board of Dermatology, Advanced Medical Dermatology Fellowship in Canada. So please welcome with me Dr. Ahmad Saleem, medical and cosmetic dermatologist. Welcome to the show.
Thank you so much, Mr. Merzouk. Thank you for having me. It's a great honor and pleasure to be in this wonderful
show.
Definitely.
So let me start by asking this. Some dermatologists, they also like talk about hairline and like advise people, but do they really take care of their own hair?
Some of them they do. The ones who do care, they do, but not all of them, I have to say.
Not all of them.
Not all of them, yeah.
That's really nice. And talking about like the foundation of our topic for today, which is hair loss.
Yeah.
What are the causes for hair loss and why does it happen?
So the causes are numerous, I have to say, but the two most common types of hair fall, number one among males and females, is something called androgenic alopecia. This is a medical term for a hereditary type of hair loss or hormonal hair loss. This is by far the most common in both males and females. The second most common is a medical term called telogen effluvium, which is a temporary disruption of the hair cycle and causes temporary hair fall. The first one is permanent, chronic hair fall, which stays with us forever. The second one is a temporary type of hair loss. It just happens for a few months, and once the cause is treated, then the hair grows back. And there are some other rare causes of hair fall, but these are the two top ones.
Of course, and do like understanding the basic or the cause of the root of the hair loss can help us like in deciding the treatment?
Yeah, so the cause depends on the type of hair fall you have. So as I just mentioned, the first one, the hereditary type of hair loss, is mainly due to the effect of hormones on the hair follicles. So that's why men get balding earlier than women because of the effect of testosterone on the hair follicles. The other type of hair fall has so many causes. You might heard of people with low iron, low zinc, people who have done surgeries, they get temporary type of hair loss. Once the cause is treated, the hair goes back to normal.
That's really awesome.
Yeah.
And knowing like about testosterone that it has effect on the hair loss. Is that like why we see a lot of bodybuilders, they are bald?
Yeah, absolutely. If you take external testosterone, if you inject yourself and you have an excess of testosterone, this is definitely going to affect your, it's going to cause hair thinning.
Hair thinning?
Yeah, for sure.
And is there like some cases that could be temporary and then could be like treat, or that are like going to be like long term for them?
So this type of hair fall, the one that happens in both males and females, if you treat it early, you can save the hair follicle. If you leave it without treatment, the hair follicle is just going to die and you're not going to grow your hair back. That's why it's very important to treat hair diseases or hair fall very early, because you have a higher chance of success and you have a higher chance of saving your hair if you treat it early.
That's really good to know. And sometimes, like one time, I remember watching like a picture, for some hair loss condition where they were doing some hairstyle like that could have a lot of pressure on the scalp.
Yeah,
so could that also lead to such cause?
Absolutely. It's a very common type of hair fall, especially in Africans who do braiding.
Exactly.
So putting a lot of traction on the hair is also can damage the hair follicle and causes a very common type of hair fall called traction alopecia. This also, by the way, happens in kids. If you do the ponytail, wear the hair very tight, you can get, you can get hair fall.
Hair fall eventually.
Yeah,
And
yeah.
that's actually, believe it or not, I used to have dreadlocks. And that the same reason happened to me, and I started to lose my hair.
Yeah. That's why we have to warn people of not doing this hairstyle.
Exactly.
It's very bad.
And talking now, shifting to the treatment itself.
Yeah.
What are the treatment options that we have in order to save the hair loss?
So the treatment depends on the cause. There is a big misconception in the public that you can, every hair fall can be treated the same. Because once you mention hair fall, especially in females, the first thing they do, they go to the pharmacy, they look for a multivitamin pill or something that has hair growth on the pack.
Like biotin?
Biotin, or the hair tablets in the pharmacy.
Exactly.
They go buy it and they think this is going to solve the problem. It doesn't work like that. The first step in treating hair diseases is the correct diagnosis. So if you have this hereditary type of hair loss, the one we just mentioned,
Okay.
the hair vitamin is absolutely not going to do anything.
Even like biotin and like
no,
supplements?
No, it's not, because the cause is different. You have to tackle the root of the problem. So going back to the treatment options, if you have the most common type, which is androgenic alopecia, the hereditary type of hair loss, you have a number of options. For example, minoxidil, a very, very common, hair treatment that almost everyone has heard of. You can use it as a topical form or an oral form. You have anti-hormone pills, and you have injections, which can be done in private clinics, things like exosomes, anti-hormone, plasma, PRP.
Like they are effective in the treatment?
Yeah, they do work in some cases.
And what is like the period for it? Like, does it take like a month, 2 months, a period of 6 months?
It takes, I would say, a minimum of 6 months to see good results.
A minimum of 6 months?
6 months. So with treating hair problems, you have to be very patient. You can't judge the treatment just from, 3-4 months. No, you have to be patient, because the hair goes in cycles, and the complete cycle of the hair takes about 6 to 8 months minimum for the hair to fall and then to grow back, and for the cycle to be completed. So it takes time. You have to be patient. You have to believe in the process. You have to be consistent. Eventually, you will get there.
Our dear friends and fellowship, like if you want to take the result, then it's like planting the seed, right? You have to
absolutely.
pour water to it like every day until waiting the plant to grow and then reaching the fruits of it.
Yeah, of course.
Talking about like also like the treatment, there are some myths. For example, like we are in Kuwaiti culture, like Arab culture, they mix some herbs, they do some special mixture and then they put like the hair, like the grandmothers, and then like they pass it to the new mothers. So what do you think about that?
I'm not against the herbal they call it treatment or organic stuff. If it does work and it's not harming your scalp, you can keep using them. But in modern medicine, we can't rely on these experiences, on other people's experiences, because in order for you to recommend a treatment, you have to do what they call a clinical trial or a study. So you do it on a big number of patients, and it's very controlled. So you take a number of patients, you give them that medication, and another group without the medication. And then you follow them in a year or 2 years, and you compare their results. So that's why that's how modern medicine works. It's evidence-based. So it's backed by evidence. So those herbal treatments, they don't have enough clinical trials to back them. So I can't confidently recommend them. But my rule is, if someone comes to me, if it works, it's not harming your body, go for it.
Go for it, and good for you. And talking about like hair loss, we cannot mention hair loss without mentioning hair implementation.
Yeah.
Could you tell us more about it, and who should take hair implementation, or who should take like injections?
You mean injections for hair loss?
Yes.
There are a number of injection options. So people who don't like taking pills, or they're not the type of people who can be consistent, they can come to the clinic every month to do the hair injection, and you just have to do it every few months. It's a good treatment option for those who don't like to take pills, or they cannot be consistent with the medications at home.
And talk about treatments. What are the treatments that you usually recommend?
So if we have this androgenic alopecia, based on trials and which one has the highest chance of success, for men it's the oral anti-hormone called finasteride.
It's like a tablet they take?
Yeah, yeah. Or there's another one more potent called dutasteride. They're both anti-hormone, but they give you the highest chance of growing your hair back in males. For females, it's minoxidil. It's one of the top treatment options as well. But unfortunately, when people hear the word minoxidil, there are always, you know, something that turns them off, because they say, I don't want to take a medication, and then as soon as I stop it, my hair falls back. But the problem is they don't, you know, you have to accept the fact that this is a chronic condition. It's a lifelong condition. You can't have diabetes and say, I want to take the insulin injection once, and then the blood sugar is fixed, and I don't have to do anything anymore. It's the same with hair problems. It's a lifelong condition, so you have to take it, you know, permanently.
Of course, that's one thing really good to know before like starting the treatment process. And there are some side effects that could happen like after starting.
There are. It depends on what treatment you get. For example, for minoxidil, the solution, you can get scalp irritation, itchiness. Some people get headache, growing hair on your face. With anti-hormone, you can get, you know, like libido issues, like things related to sexual function. They are very uncommon, but these things can happen.
Okay, and how do you measure like the success rate of the treatment itself?
There are a number of ways. So the first thing is the patient himself. Sometimes patients do notice growing their hair back, but the more accurate way is taking pictures with the magnifying lens, or now we have, with the advancement of technology, we have machines where you can take pictures of the scalp and they calculate the number of hair follicles.
Like before
and they compare, they compare it very accurately. So you can measure, you know, a long time how the patient is responding to
how
the treatment.
The patient is responding.
Yeah, yeah.
And in the cases that you are daily like facing, was there like a success story that you remember?
Yeah, of course, there are many success stories. yeah. Some people, you know, come to you, they think they have, you know, they can't do anything except hair transplant, but when you try, you know, you have to be consistent. It all depends on the patient.
On the patient himself.
Yeah, if you're willing to put effort in the process, you're consistent, you're patient, eventually you will get results. Most of them, they do get results.
That's really awesome, and glad news to know that things like that is happening, and good positive feedback is really happening in the future. Yeah. And talking about like positive feedback, and also talking about like treatment itself, they say like stomach is the source of all diseases and the source of all healthy lifestyle. So could diet and nutrition affect our, could have the direct effect to the hair treatment? Yeah,
it does have an effect. If you have low vitamin levels, it's definitely going to affect your hair strength and, you know, hair growth in general. If you have low iron levels, this can also affect your, so this can be related to diet, or it can be related to a problem or a disease.
During treatment, is there like specific diet that patients should be on?
No, not really, but we always recommend the high protein diet.
High protein?
Because hair is made of what? Hair is a protein, keratin. Keratin is a protein. So if you have a good protein diet, that's good in general for the hair.
And what are the recent diagnosis approaches that have been trending recently in the clinics?
It's one of the things I just mentioned is they call it, I forgot the name, it's a machine. It has like a magnifying lens and then a screen. And then you put the machine on the scalp, it calculates the number of hair follicles. It does a lot of, it calculates the diameter of the hair itself and the strength and so many useful information. And with that information, it can help a lot with the diagnosis.
With the diagnosis?
Yeah, it can help big time.
And this question that's like been itching so far. Sometimes I saw before like there's a cat, okay, you brush the cat and then you brush your hair, is they gonna like lead to hair loss. Is that like a myth or?
No, it's the same. It's exactly the same when people believe that shaving your beard with a razor, it's going to make it thicker. But this is absolutely no
valid reasons or bias or like sciences.
No science to back this up. You can try it. I don't think you'll ever grow hair thicker if you shave with a blade.
That's really good to know. And for all the teenagers that's watching us, don't try this or falling into this trap. Thank you so much, Dr. Ahmad Saleem,
Thank you for having me
being with
here.
us, informing us
great.
about like the hair treatment and what are the possible situations or solutions that we can take in order to recover our hair and have our charisma look.
Thank you so much for having me. It's a great honor and pleasure. Thank you so much.
Thank you so much. And now, our dear viewers, moving on with our segments for today, we're going to take a quick break and then we're going to be back.